Welcome to Week 7 of the DPS NCLEX Success Track. This week is not about learning new content. It is about consolidating everything you have learned from weeks 1 through 6 and turning that knowledge into reliable clinical judgment. Week 7 helps you stop guessing and start using a consistent decision-making system for NCLEX and NGN. NCLEX does not test how much information you can memorize. It tests how you think when multiple answers look correct. Priority, safety, and judgment always outweigh isolated facts. If you use a system, NCLEX questions become predictable. Next generation NCLEX follows a fixed clinical judgment model. You recognize cues, analyze them, prioritize hypotheses, generate solutions, take action, and then evaluate outcomes. One critical rule after every intervention: you must reassess. NGN always asks, did the patient improve? The NCLEX strongly prefers early signs over late signs. Late signs mean the patient is already critical. Nurses are expected to act before collapse, not after. Recognizing subtle changes like restlessness or tachycardia saves lives. Physiological integrity dominates the NCLEX exam. Week 5 and Week 6 content appears repeatedly. Focus especially on shock, respiratory failure, neurological deterioration, bleeding, and sepsis. These topics are frequently tested together. Shock questions test cause-based thinking. Hypovolemic shock comes from fluid or blood loss. Septic shock comes from infection and vasodilation. Cardiogenic shock results from pump failure. Anaphylactic shock involves airway compromise and hypotension. Treat the cause, not just the blood pressure. Respiratory failure is often tested through trends. Early signs include tachypnea and restlessness. Late signs include cyanosis and decreased level of consciousness. Any increasing oxygen requirement is a red flag. Airway always comes first. The earliest sign of neurological decline is a change in the level of consciousness. Cushing's triad is a late and dangerous finding. Do not wait for all three signs to appear. Early recognition prevents irreversible brain injury. In bleeding scenarios, restlessness and tachycardia appear before hypotension. Unexpected bleeding always outranks pain on NCLEX. Do not focus on one lab value: trend hemoglobin and hematocrit over time. Medication safety is frequently integrated into clinical scenarios. Opioids can cause respiratory depression. Insulin affects potassium levels. Anticoagulants increase bleeding risk. New medications raise concern for allergic reactions or anaphylaxis. Use the same framework for every question. Practice explaining why incorrect answers are wrong. This week prepares you for the full mock exam in Part 2. Week 7 is where knowledge turns into confidence and higher scores. Let's start with a priority question. On the NCLEX, when multiple answers look correct, which principle should guide your very first decision? A nurse is caring for a patient with multiple findings. Which principle should guide the nurse's first decision on NCLEX questions? Question 1. A. Maslow's hierarchy. B. ABCs and safety. C. Nursing diagnosis order. D. Patient preference. The correct answer is ABCs and safety. No matter how complex the scenario, airway, breathing, circulation, and safety always take priority on the NCLEX. Question 2. Which finding represents an early sign of patient deterioration? A. Hypotension. B. Cyanosis. C. Restlessness. D. Unresponsiveness. Correct answer is C. Early signs: restlessness, tachycardia appear before late, life-threatening signs. Question 3. Which situation should the nurse address first? A. Chronic pain rated 710. B. Stable patient requesting discharge education. C. New onset of confusion and decreased urine output. D. Patient with controlled hypertension. Correct answer is C. New confusion and urine output indicate instability and possible deterioration. Question 4. Which statement best reflects NGN-style clinical judgment? A. Memorize lab values. B. Treat symptoms only. C. Recognize cues and evaluate outcomes after intervention. D. Focus on one body system at a time. Correct answer is C. Rationale NGN emphasizes recognizing cues, acting, and evaluating response. Question 5. A patient becomes restless and tachycardic after surgery. Blood pressure is still normal. What should the nurse do? A. Reassure the patient. B. Wait until hypotension develops. C. Assess for bleeding immediately. D. Administer pain medication. Correct answer is C. Restlessness and tachycardia are early signs of hemorrhage. Question 6. Which lab trend is most important for identifying sepsis early? A. Single normal WBC value. B. Trending increase in lactate. C. Low potassium. D. Stable creatinine. Correct answer is B. Rising lactate reflects tissue hypoxia and early sepsis. Question 7. Which patient requires immediate nursing action? A. Patient with mild post-op pain. B. Patient with stable vital signs requesting food. C. Patient with increasing oxygen requirement. D. Patient with chronic edema. Correct answer is C. Increasing oxygen needs indicate respiratory compromise. Question 8. Which finding suggests neurological deterioration? A. Mild headache. B. Fatigue after activity. C. Change in level of consciousness. D. Slight dizziness when standing. Correct answer is C. Lock changes are the earliest and most critical neuro-warning sign. Question 9. Which principle should guide answers when multiple options seem correct? A. Choose the longest answer. B. Choose what the provider would do. C. Choose the option addressing instability first. D. Choose patient education. Correct answer is C. Rationale unstable problems always take priority on the NCLEX. Question 10. What is the best strategy for Week 7 review? A. Memorize more content. B. Use different strategies for each question. C. Apply the same priority framework to every question. D. Skip rationales. Correct answer is C. Consistent use of one framework improves accuracy and speed. If you struggled with any of these questions, that's normal. Week 7 is designed to fix those weak points before the full mock exam in Part 2.